Hey, I just washed these instruments. Could you show me how to put them in a pack?
Yeah, so after they're done drying from the instrument milk, you'll want to make sure you have all your instruments. You're also going to put the gauze in there, which we already grabbed, but you're going to have 3 non-hinged instruments, which is these 3. You'll have 3 different kinds of scissors. You'll have 4 of your larger hemostats, 4 of smaller ones, and then 4 towel clamps are in all our surgery packs. They're all the same. And then also by making sure they're all the same color. And then we do have our wrap templates that you can, when you need more, you'll just have to unfold it and pull from our drape box and make them the right size. But we have some extras that are left over that we can still use. So we'll lay them out kind of diagonally, and then you're gonna want the lighter blue, like softer side inside. It's just less abrasive for the instruments, so that's the side we use. And then we stack them in the middle, and it's kind of tricky to get them like to stay stacked. But once you get the hang of it, you'll be able to. So I'm gonna start with this, and then I put my non-hinged instruments in the middle. That. And then usually my larger instruments I put on the bottom. So I'll put the smaller ones on top. It's not necessarily important which instruments go on which side. Like that. And then usually for our gauze, we don't count how many pieces of 2x2s we have in here, but I usually, like when I'm pulling from the pack, it's usually about like a finger's length, and then put it like 2 stacks in the middle.
Where would I grab those if I wanted to get new ones for a pack?
It's above the computer, next to our table, so in the cabinet up there.
Okay.
And then you'll fold your bottom quarter in, and you're gonna do an accordion fold, like that. And it's not as important how many times you did the fold, as long as your corner is facing out away from the inside, to make sure it stays sterile when you open it. I usually try to keep my hand on the instruments to make sure I can keep them stacked, and then I'll pull back to make sure my wrap stays tight. Then you'll pull from the sides into your accordion, like that, and keeping it tight still. And then from here, you can always like tuck your instruments in if they kind of slide or go anywhere. But keeping your hand on the middle will help kind of keep them in one spot. Then with your last corner, you're going to tuck it underneath the envelope between here and your layers. Make sure it's kind of tight. You also don't want to snap the hinged instruments closed on the like little ratchet clamps. So that's just helps make sure they stay sterile. And then we have a drape that I just ripped a hole in. So sometimes that happens with our drapes, that we reuse the tape. So we'll just go ahead and cut it in one.
And we want them long enough so that they can hang over the surgery table, right? Like the instrument table.
Over our little Mayo stand where the doctors are going to put their instruments, you want it to hang like an inch or 2 off each side. So it's always better to have them bigger rather than smaller.
Good to know.
But yeah. So we have another layer. Our surgery packs get double wrapped. So we're just going to wrap it the same way as we did before. And it's easier to keep this wrap a lot tighter just because you're not fooling with all your instruments. accordion fold everything. Last one gets tucked underneath, in between. That. And then we label with our upplay tape. So it's like that. And then we write what we wrapped, the date and the initials. So I believe these were larger instruments.
So it would be called a large surgery pack.
Yeah, just because not the giant hemostats, but the smaller ones, we have like two different ones. We have like a medium size, and then we have like these really small ones. So sometimes it might depend on the procedure if they want a certain size, but if you don't remember, it's not the end of the world.
Okay.
But that's it.
All right. Awesome. Thank you.
You're welcome.